Welcome back to Mountain Connections. Recently, there's been a concerning RSV surge, which is unusual during the summer months, especially in the South. I recently spoke with Dr. Michael Forbes all about RSV, what you need to be concerned about, and what you need to know about this current surge. Let's take a look.
Health officials, including the CDC, Centers for Disease Control and Prevention, are concerned about a recent off-season spike in RSV, a common contagious virus that causes a flu-like illness across the southern United States. Here to explain what parents of babies and toddlers need to know and why they need to be on alert is Dr. Michael Forbes of Northeast Ohio Medical University and Akron Children's Hospital. Thank you so much, Dr. Forbes, for being here.
Thank you for having me. Appreciate it.
What can you tell us about the early summer surge in RSV cases, which occurred outside the typical season?
Yeah, so we're in the middle of a national surge. RSV, as you alluded to, is a common respiratory virus that causes cold and flu symptoms, usually in the cold and flu season. What we're seeing this year, however, is a surge in the middle of the summer, which is probably a response to a lot of the public health measures that we put in place last year to contain COVID-19. What that means, though, is that our background immunity this year is a lot lower because we just did not have the exposure. Nationally, in early June, we had a 3% positivity, and 3% is the beginning of the RSV epidemic. 2 weeks in a row at 3% or more is the beginning of an RSV epidemic. We are currently at 15% in early June. Where I am here in Akron, Ohio, about 30 minutes south of Cleveland, we're hovering around 30% positivity, and so it's a real surge. It's happening in the middle of the summer, and we're hoping that it peters out before things get worse.
Absolutely. I have a friend in Arkansas whose baby came down with RSV about a month ago. So what does the CDC recommend because of that unusual spike in cases? And what does it mean for the season ahead, especially out west?
Yeah, great question. The CDC gave us an advisory in the spring that basically said be on the lookout for more RSV. And clinically, what they gave us the advice was to test a little bit more. And there was a real focus from the CDC to pay attention to the uniquely vulnerable patients. That's infants and toddlers, particularly preterm babies. So by the age of 2, we know nearly all kids have been infected with RSV, so anyone can contract it. But we know that preterm infants in particular are uniquely vulnerable to RSV. They're about 2 to 5 times more likely to be hospitalized in the first 6 months of life due to RSV-related symptoms and have severe disease. The reason for that is that their lungs are immature because they're born early, and their immune systems are immature because they're born early. And so that combination really sets them up to have severe disease. And so we want to be mindful of that and be aware of that. So I appreciate the opportunity to share that. About 10% of all kids are born preterm in this country, and that number's rising. So we'd really like to new parents of preemies to be aware, new grandparents of preemies to be aware that it may look like a cold, but it may very well be RSV, and that there are some things that you need to find out about from a preventative standpoint so that your baby doesn't get that in the first place. There's no treatment actually for RSV, so prevention is critical.
Dr. Forbes, explain exactly what RSV is and why it should be on parents' radars now more than ever.
Yeah, great question. So RSV stands for respiratory syncytial virus. The syncytia part refers to the type of unique damage that it does to the lungs. It is a very common, seasonal, typically, highly contagious virus that happens every year, typically in the cold and flu season. Because of the loss of background immunity, we're seeing a surge in the middle of the summer. One of my colleagues referred to it as Christmas in July. We've just never seen this much RSV in the middle of the summer. And so for parents, what I would recommend is talk to your healthcare provider to find out if your child is uniquely vulnerable to RSV. So prematurity, very important. Pre-existing lung or heart disease, very important. And again, we don't really treat RSV. We prevent RSV as best we can. And so talk to your healthcare provider to see if your child's uniquely vulnerable, and also to find out if there's anything that they can do or recommend from a preventative standpoint to make sure your child doesn't get that in the first place. And so raising awareness, I think, is job one when it comes to prevention. And so I'm really proud to partner with SOBI to raise awareness about RSV. Again, it may look like a cold, but if you have a uniquely vulnerable child, child, you need to know if you're dealing with RSV.
You mentioned that it looks like a cold, but are there any unique symptoms that parents should be looking out for with RSV?
Yes, I think it's important to know that it can start like a cold, but it doesn't go away. And so the sneezing and coughing just kind of persists. You may also find as kids have nasal flaring, they may retract when they're breathing. You can actually see them work to breathe. Some kids get a bluish discoloration around their nail beds or around their mouth. About 40–50% of kids will get a fever as well. And so it looks like a cold, but it kind of progresses into more than that. If you start to see that, you want to notify your healthcare provider as soon as possible and get medical attention. And I think it's a good opportunity before that happens to actively partner with the child's pediatrician to say, hey, is my child uniquely vulnerable? Are they uniquely vulnerable for severe disease? And discuss with your pediatrician, your healthcare worker, what preventative options are out there to not get RSV, frankly, in the first place.
What advice do you have for parents of little ones to help protect their children from RSV?
Yeah, terrific question. You know, it's going to be tough. School's about to open. We know that you're at increased risk if you're in daycare because, you know, the siblings of that infant or toddler will go out and come back, and they can certainly bring it home. If they have school-age siblings, they can also go out and bring it home. But what you can do in the meantime is continue to wash your hands, which I know folks are doing right now anyway, but make sure their toys are clean because RSV can stay on the toy. It can stay on any flat surface. If you're sneezing or coughing or symptomatic in your own home, you want to cough or sneeze into a tissue and toss it. We don't want people coughing into their elbows anymore. Sometimes you rest your baby's head into your elbow, right? And so making sure that if you have someone in your home who's ill, if you can have them in a separate part of the home in a different room so that they're not spreading the infection throughout the house. And finally, I think knowledge is power. So I think rsvprotection.com is a terrific website full of information, not only about RSV, but about infants, toddlers, and protection, and how to make sure that hopefully the baby doesn't get infected with the virus in the first place.
I had a daughter years ago when she was a baby come down with severe RSV and was hospitalized. It was absolutely terrifying. And I really appreciate you being here today with this informative information for our viewing audience today. Dr. Forbes, thank you so much.
It's my great pleasure. Thanks for helping raise awareness. I appreciate it.